We want to talk about gestational diabetes. That means diabetes that happens while a patient is pregnant. These diabetes usually resolve after pregnancy. Although if you have a gestational diabetes, you have a higher chance of having diabetes later in the life. Gestational diabetes is caused usually by the placenta and the hormones that it secretes, and that affects how a body responds to sugar. And this patient have high sugar level and high insulin, and it can cause certain problem with the baby's growth. Mainly they have larger babies and higher amount of fluid around the baby. These are the main things. Although if it's really out of control, the sugar level, it could be also a problem in the development of the heart and other body part of the fetus. But again, if it's controlled, there is no effect on the baby. We usually check the mothers who are not diabetic at 28 weeks for gestational diabetes. All the patients get 1 hour sugar test. That's when you drink something called the glucola, and 1 hour after drinking, we check the sugar. If that's normal, you don't have gestational diabetic. If that's abnormal, we do something called a 3-hour sugar test. If that's also abnormal, then you're diagnosed gestational diabetes. Then you have to start checking your sugars, and you might need pills or insulin or other medications to control the sugar. Sometimes these patients with diet, exercise, can have a good sugar control and they don't need any medications, but they have to be followed closely. And again, depending on what kind of treatment they need further and how controlled it is, they might need certain tests or certain procedure to be done, or might have to be delivered earlier depending on baby size and other factors.